Hi everyone, welcome to GoLocal Live and Smart Health with the Warren Alpert Medical School at Brown University. I'm GoLocal News Editor Kate Nagel would like to welcome in today's guest, Dr. Steven Schechter, a colorectal surgeon with Brown Surgical Associates and a professor at the Warren Alpert Medical School. So doctor, thank you for joining us today.
My pleasure.
Well, I appreciate your taking the time to come in as March is Colorectal Cancer Awareness Month. But before we even go into the month, I want to talk a little bit about your path to the Brown Alpert Medical School.
Sure. Well, I finished college at Queens College in New York City and escaped. I went to the University of Rochester, where I received an MD, and then did a year of internal medicine at the University of Connecticut, continued heading east to Brown in Providence, did my 5 years of general surgery, and then did colon rectal fellowship at Rutgers UMD&J, and then came back to Brown, and I blinked, and 25 years passes rather quickly.
Okay, and with March being Colorectal Cancer Awareness Month and it being 2020, let's talk a little bit about that awareness around colorectal cancer and sort of what the message is that you're getting out to folks in the community as you're raising awareness.
Sure. Well, first a shout out for people to wear blue for a month of March for colorectal awareness. Now, colorectal cancer is the third leading cause of cancer in the United States, and the American Cancer Society gave us some good news a couple of years ago that the incidence is decreasing for people who are over 50 because of the success of colon cancer screening. But for people under 50, the incidence has increased about 20%. So we know that about 140,000 people will be diagnosed with colorectal cancer this year, and there'll be about 50,000 deaths, so it's pretty significant. But again, the good news is this is something that's entirely preventable. People have to realize that colon cancer starts with polyps in the colon, little growths, and it takes 5 to 7 years minimum for them to become cancer. So there's a lot of time to actually have a screening test like colonoscopy to prevent and remove these polyps and prevent colon cancer.
So do we have a sense that data from the American Cancer Society, again, good news on the older people's front, but for the younger people, do we have a sense as to why we're seeing a higher incidence of colorectal cancer at a younger age?
Well, that's a hot topic and a very good question. We know that there's links between obesity, meat consumption, alcohol consumption, and with colorectal cancer. The question is, what are the genetic changes that are taking place? There could be certain environmental causes such as insecticides, other chemicals that we're being exposed to. So we don't really know why, but we do know Dr. Church from the Cleveland Clinic, who's a leading research expert about this, recently came out with the concept of, hey, most of these cancers in the young people are on the left side, the lower colon, and within reach of a short colonoscope called a sigmoidoscope. So we could actually start screening people at age 40 and even checking the stool for blood, which is a simple exam in the office. And that may be what we need to start catching people with preventable polyps that prevent, and then it'll prevent cancer developing.
So of course, sort of the general rule of thumb now we know is you turned 50 and you know you're up for that first exam. The American Cancer Society made these recommendations for earlier screenings, but things can move slowly in the healthcare world, especially on the insurance side of things.
Correct.
Do we see a potential, in 5-10 years' time, is it going to be you hit 40 and your doctor says, time for your first screening?
I do. I think we're going to be very clever in terms of who we screen, and we'll have genetic testing possibly be easier and cheaper to focus in on high-risk groups.
Okay.
Certainly, 75% of colorectal cancer is sporadic, but 25% is familial, and it depends who your mother and father and grandparents were. So we also have to recognize for Afro-Americans, screening is accepted to start at age 45. This is important. If we back everyone down to 40, the concept is taking care of the patients who develop cancer, because it's not just that you get cancer, it's that you then need surgery, and if the cancer is advanced, we're talking about chemotherapy, possible radiation.
So with your role at the Alpert Medical School, as you said, you blinked 25 years, went and passed by. As we sit here, it's 2020, looking forward, how has it been working with the Alpert Medical School, at that cutting edge of, again, looking at identification at an earlier time and the treatment as well? Is the future bright?
Well, certainly the more we learn, the better it winds up being better patient care. And the Brown Surgical Associates and at Warren Alpert Medical School, it's wonderful working with residents and other educators. And we've had tremendous advances in terms of just the surgery of colorectal cancer, laparoscopic surgery, and now robotic surgery. And also the multidisciplinary approach, bringing together oncologists, pathologists, research people, and surgeons, and looking at a patient and really putting together their treatment from A to Z. And that is so crucial in colorectal cancer treatment.
And so, again, continue to see more advancements in the treatments. Again, you talk about the laparoscopic, just being able to really get into the body where you need to address the cancer.
Right, we get into places that are difficult, but also the incisions are much smaller. There's less trauma to the body, there's faster recovery, people in the hospital less, and the results are amazing. When you look at the advances that were made in chemotherapy alone, the oncologists are doing a fantastic job in getting rid of people with, let's say, stage 3 disease. Stage 1 and stage 2 usually don't need chemotherapy, radiation, or radiation after surgery, but stage 3 will, and then there's stage 4. And it's just amazing how these patients are living longer and really having very fruitful lives.
And of course, was the blue on purpose for Colorectal Cancer Awareness Month?
Right, exactly, and that's the color of the month, and we should focus on it. We should all ask our parents and grandparents and our friends, and I guess I'll ask my friends. I'm over 50. I've had 3 of them, and it's safe. It's really simple, it's straightforward. Again, shout out to the endoscopy nurses, the people that work in these settings who are very passionate, and patients are really respected and taken care of very well.
And again, to go back, just how critical is it for early detection? As you said, again, that polyps, that 5 to 7 years. Again, folks who said, okay, I guess I'll get it, and the doctors do recommend it. Is catching it early the most critical component of addressing colorectal cancer?
Absolutely. The concept of preventing any disease process means that going from A to Z, from benign to malignant, from good to bad, has to be a number of years. And that's the perfect example of colon cancer. Think of pancreatic cancer. By the time you find it, it's usually too late. So the idea of screening is great. And we have so many different screening techniques. We have Cologuard, which is a technique to check the stool for fragments of genetic diseases, genetic tissue from the tumor. We have a stool test for blood. We have X-rays. Virtual colonoscopy is kind of a CT scan of the abdomen, and it focuses in on the colon. So we have more than just colonoscopy. Colonoscopy is the gold standard, but the real answer is any screening test you take is the best test. Okay,
again, looking at those numbers going down to look at screenings to start younger than that now, 50. We'll probably see more of this moving forward, but really this week about colorectal cancer awareness, and on Friday, wearing blue, having everyone do it.
Yes, let's do that and turn thought into action, and really look around to our friends and family and say, hey, are you ready to get screened?
Okay, ready to get screened. Dr. Steven Schechter with the Brown Surgical Associates, colorectal surgeon, and of course the Warren Alpert Medical School at Brown University. So doctor, thank you for joining us today. We'll provide key links when you turn back and find this on GoLocal Prov later. And of course, when you see us pop up on live, tune in and watch. I'm GoLocal News Editor Kate Nagel.